Welcome, everyone. We are doing our in-person grand rounds today. I'm Dr. Betsy Trowbridge. I'm the Executive Vice Chair for the Department of Medicine. And we have an incredibly amazing speaker that we are very honored to bring here to the University of Wisconsin, who happened to be a roommate of one of our faculty members in GI. And Dr. Jen Weiss invited her here. And so she's going to come up and invite our speaker. So Dr. Weiss, come on up.
Thank you. So Kelly and I went to medical school together. So Dr. Harding is a psychiatrist based out of New York City with expertise in mind, body medicine, and public health, and is known for making complex scientific research understandable to general audiences. She did her undergrad work at Berkeley and went to Rochester for medical school, and then did an internal medicine prelim year at Mount Sinai and psychiatry residency at Columbia. And at Columbia, she also got a master's of public health. So I have to read the credentials before I give you guys just a little personal introduction for Kelly. So after medical school, and her residency and her master's degree, she spent much of her time working clinically at Columbia's New York Presbyterian Hospital emergency room. So she's got some stories to tell from that, I'm sure. She's also the author of the critically acclaimed book, The Rabbit Effect: Live Longer, Happier, and Healthier with the Groundbreaking Science of Kindness. And so that's where, when I saw that book, I was not surprised at all, because she is the kindest person that I have ever met. So I'm going to cry now. But Kelly has always been a role model for me. I mean, from the first day of medical school, when she was the president of our medical school class at some point, and then became the chair of the AAMC Organization of Resident Representatives. And then I tried to follow suit after her like a year later, 2 years later. So we crossed paths again during residency, and have always been able to find each other. So I'm very excited to have her here.
Gosh, thank you for that incredibly warm welcome. I can't think of another place I would rather be today than to be here with all of you talking about this subject that feels so incredibly important. I have to say, I am super excited, and we're going to cover a lot of ground today. But first, just to begin, I wanted to ask this question. Would you like to learn more about a skill that you have right now in this very room that can make a real difference in your life and the people you serve and you interact with? Sound good? Woo! All right. Excellent. So I'm so glad, because you're about to go on a tour de force through public health. So we're going to have a really good time. So what we're going to do today is talk about the big picture of health. And I know when most people and when many of our patients think about health, and people in the general public, they tend to think about medical centers like this. They tend to think about, occasional trips to the clinic, diet, sleep, exercise, maybe the genes that they inherited as well. But again, we're going to be talking about a critical but often overlooked key component of health, and that's kindness. So before we begin, I have a couple of disclosures, and I feel like talking about the subject of kindness, I have to say, so I am human, and I am not kind all the time, and nobody is kind all the time. And we're going to talk a little bit about that as well. And the other thing is, I approach this subject as a learner myself, and I think I approach it with humility. So if I say something that you feel you wish it was said differently, or you think I could learn something from, please feel free to email me. I have my email right here, and I would love for you to reach out and continue the conversation. So, all right, with that, shall we begin? Okay, sounds good. Oh, one other thing, if I want you to listen for things that inspire you and maybe jot them down or keep a note somewhere, and then also listen for things that might be helpful for somebody else, and feel free to jot that down and teach them as well. So, all right, let's begin. Oh, I also included my learning objectives. So one thing I would like for everybody to walk out of this room with one thing that they want to implement going forward, and hopefully immediately in your day going forward. All right, so just a quick word about how I got interested in this topic. So as Jen described, I started in internal medicine, I trained in psychiatry, and then all throughout, I was always sort of interested in the cases that didn't quite fit in the textbook model of disease. And so these are the medical mysteries that I suspect many people in this room and online love. So what I'm talking about are things like the placebo effect. Like raise your hand if you've had a patient who's gotten better essentially from a placebo. Yeah, so I'm seeing hands go up, or the nocebo effect, which is also fascinating. So patients who've gotten sick from things that they thought had ingredients that turned out to be inert, which is really interesting. The other thing I got really curious about is when you'd have two patients with the same disease and two very different courses of illness. And so it was this question of, what are we missing in medicine? And this led me down this pathway of training where I thought it had something to do with the mind-body connection. I even ended up doing a research fellowship in medically unexplained symptoms at Columbia, and which was fascinating, but I still didn't really feel like I had the answer. And then during my research fellowship, one of my lovely mentors, a fellow named Dr. Arthur Barsky, who's at Harvard actually, he suggested I should check out this study about rabbits. And I'm going to go ahead and just share this study with you, but it sort of changed the course, and I think it's a good framing for us as we start to sort of dive into this subject a little bit. So I'm going to take you back in time to the 1970s. There was a researcher, a lovely fellow by the name of Dr. Robert Neerum, who was looking at heart health of rabbits. And I'm pointing because we have a cardiologist in the audience. So anyhow, he designed at the time, there wasn't a lot of, it was thought that diet might impact cardiac health. So they basically fed these essentially genetically identical rabbits, very high fat diet, with the idea that they would all develop the same cardiac profile. And when they went to look at their results, I should add, Dr. Neerum was a basic scientist. This was his focus. So when they went to go look at the results, they discovered that that one group of rabbits had very different outcomes than the other rabbits. Like when they actually looked at their arteries, it was like a 60% difference. And they thought it was, being good researchers, they thought it was just a mistake in their protocol, that they had done something wrong. And so the thing is, everything checked out. So then, because of that, they sort of looked up and they realized that the group of rabbits that had done better were all under the care of one postdoc. And that's when they discovered that that postdoc wasn't doing the sort of standard of rabbit care, just giving them kibble. She was actually picking them up. She was petting them. She was talking to them. She was essentially giving them love and kindness. And so with that in mind, what they ended up doing is, and this is where I give Dr. Neerum real credit, because again, the easiest thing would have been to replicate the experiment without that researcher. But when I talked to him, he said, if this is the case, that somehow the social world changed these animals' biology, this is a huge finding. We have to pursue this. And so in fact, they did replicate it. They got the exact same results, and they published it in the Journal of Science. And that was decades ago at this point. So now, decades of research subsequently have passed, and we're going to talk a little bit about that. But I have to say, when I heard about this study, and maybe as you hear it too, this is not how I learned the human body works, right? That things from our social world could somehow change biology. This was definitely not the model. However, there's some clues that maybe we don't quite have the model right. And I know this model's changing and I'm so excited about that. It's also not quite there yet. And that's part of why I'm here and feel so passionately that we talk about this. So, so this is data from the Commonwealth Fund from 2021, and it covers both pre-pandemic and 2020 data as well. The thing that's interesting about this is it's pretty much looked the same forever. So what it's saying is basically when you look at the 11 wealthiest countries in the world, and I know this is probably not surprising data to anybody, and then you look at our health outcomes, and then you look at how much we're spending. The US is like pretty much like not even on the same graph. And it's looked like this consistently over time, which is just something to be aware of. Like, you know, a child who's born in the US is less likely to reach her 5th birthday than in other wealthy nations. We have higher rates of things like car crashes and, you know, depression, all kinds of chronic illnesses, and it's across the board. And of course, there's the data around life expectancy as well, which is deeply troubling, especially given, I know as clinicians, like how hard we're working to keep everybody healthy and well to see these kinds of outcome data. And then there's this statistic that has been lurking in the background for some time. So what this is that it's been estimated that about only 10 to 20% of our overall health status is due to direct medical care. So I don't know, as a clinician, this was like really shocking because, you know, what's that other 80%? And you know, it turns out, you know, genes do play a part of that, but now thanks to advances in epigenetics, we know that genes are actually also interacting with the social world in a way we hadn't previously appreciated. And it turns out the rest of our world is quite making a difference. Another area we're seeing this, which thank goodness we have a Surgeon General who's paying attention to this and calling it out to people. And I love when I hear people just in the general public talking about the risks of loneliness and social isolation. So just for definition's sake, so social isolation is the number of people that you interact with during a day. And we know that for many older adults across the world, actually, but even more so in Westernized societies, that they often can go days to sometimes a week without seeing anybody other than like the television. So just to put that in perspective. And the other group that is particularly affected, believe it or not, is young people. And so probably some of the people that are of the age group of people sitting in this room. And then there's loneliness, which is the subjective feeling of not feeling like you're connecting with somebody. And Elvis Presley famously described feeling lonely even in a crowded room. So that's the feeling of loneliness. And it turns out both matter to your health, and they're sort of different veins of research study, but they both matter. And some of the risk factors won't surprise you. So I'm just they're up here, but they're all the things of the patients that you're seeing essentially. So chronic diseases, functional impairments, mental health, physical health, and then other differences as well in life stages. What I love about this, and I should just highlight the wonderful work of Julianne Holt-Lunstead, who actually helped write this document. And she's just done beautiful work, and it's really fun to look at her studies around mortality and loneliness, and it's really quite profound. What I love is she puts the answer right up front. The healing effects of social connection and community are right there. But here's the thing. So we know it's a risk factor, but what do we do about it, right? Okay, so we know now that pro-social connection, so we know the effects, the harms of not having social support are significant and real. And then we also know that the benefits can also be good. And it's funny because I don't know, when you get really excited about this researcher and you go to try to talk to a patient or someone about pro-social connection, you get some eye rolls, like even among my physician colleagues where I'm like, and this is why I wrote a book. It was like there's this data and there's like decades of data and we got to be doing something about this. And you should see people's like eyes kind of like shift, like the conversation becomes uncomfortable. So here's the thing. We all know pro-social connection, and you've known it your entire life as something much more fundamental, which is kindness. And you know, what's great about kindness is that even from a very early age, everybody gets this. They know what it's about. And you can talk to people who are not necessarily in public health or in medicine, and still they get it, they understand. So just a couple facts about kindness. So what I think is really fun about kindness and sort of mysterious and cool is, oh, I'm sorry, this is the definition first, the research definition. But here's the thing, I probably don't even need to, so I'm gonna read it for the people that maybe can't read the slide. An act that enhances the welfare of others as an end in itself. And it's not, the thing is that definition, expecting nothing in return, right? So it's not quid pro quo or anything like that. It's just expecting nothing in return. And again, every one of you can probably think of an instance of kindness that you've seen in the last week or the last couple days. And you know kindness when you see it, which is pretty remarkable. And we also know that it benefits the giver, the receiver, and the observer, which is pretty amazing. So there's this like virtuous cycle that happens with acts of kindness, which is really fun because that means if you do something kind, you may not ever know the benefit of it because it may not actually have been, like you might not have realized who witnessed that, which is also really lovely. So what I did is to try to take, so this is based on the biopsychosocial model of medicine, which I'm sure everyone in this room is thankfully familiar with. And then I tried to meld it with the words and research from public health. And I'm gonna take you through some of that right now. So that's you at the center there, and then all the different areas of your life. And it's not just you, obviously, it's also your patients. So I wanna, as we start thinking about this bigger picture of health and how kindness plays a role in it, we're just gonna go through this. So I realize I'm gonna cover a lot of data in a little bit of time, but I'm gonna try to make it as engaging as possible. So we're gonna talk about 6 of the hidden factors of health or social determinants of health and that affect every single human being. I know in medicine, oftentimes when we talk about social determinants, I feel like people sort of go with the extremes, but actually every one of us is immersed in an interactive, dynamic social environment every single day of our lives to the point we don't even notice how it's playing a role. But it's cool because there's data that shows us, particularly from the world of public health, how it's impacting our health. Okay, so number 1, of course, is supportive relationships. So from a mother's first embrace or a parent's first embrace, we know that you have started on this journey of kindness. Like not a single person in this room would be here or online if it had not been for the kindness of your caregivers when you were born. And that's amazing. And there's also, so this is actually a picture of what's known as kangaroo care that was started in Bogota out of dire necessity where they just didn't have enough incubators for the preemie babies that were born. And a physician decided to see if he could try to keep some of the babies alive by putting them on a parent's chest. And sure enough, about 75% of the kids who received the kangaroo care survived, whereas 0 did who received the sort of standard care because they just didn't have the sort of medical ability to do that. Subsequently, it's saved hundreds of thousands of lives around the world, according to the WHO. It also continues, I'm very pleased with this slide. Sorry. So it also continues throughout our adolescence. And so there's the Duden studies that are out of New Zealand have tracked from birth, it was like from the 1972 to 1973, about 1,000 kids from a hospital in New Zealand. If you're not familiar with the studies and the research, it's amazing. Like I can spend hours like going through all the different studies. They've tracked these people over their lifetime. And so, you know, now as they're approaching their 50s, they know a lot. And it turns out that relationships in adolescent can help predict health outcomes when they hit middle age. And I'm just going to highlight one of those studies. So, so this was a study where they looked at the social isolation of some of the individuals, and it turned out that those who had experienced social isolation had elevated age-related risks in adulthood, and it was like a pretty significant increased risk of developing age-related diseases. So it's strange to think that an effect that's happening, you know, in adolescence is affecting the patient that you're seeing in clinic today, right? Like that is pretty mind-boggling and an important piece of history that we don't always think about when or social history that might be contributing to somebody. And then, of course, there's the wonderful Harvard study of adult development, and that kind of picks up in the college years. So I'm sure probably most people in this room are familiar with that, where, you know, back many years ago, I'm trying to remember when it started, it was started looking at Harvard undergraduates with like the most famous, I think, being JFK was in the cohort. And then they also used a control group of of boys who were growing up in Boston who were not attending Harvard, college-age men, and then comparing them over time. And what they found, and this is really wonderful, and Dr. Waldinger has written a book that's lovely on this topic just recently. I'm going to go ahead and read this for the people that are here. So the people who were the most satisfied in their relationships at age 50 were the healthiest at age 80, which is so wild. And George Ballant, who was the original director of the study, had this to say: when the study began, nobody cared about empathy or attachment, but the key to healthy aging is relationships, relationships, relationships. Wow. Like that is not what I learned. As wonderful as my medical school was, where Jen and I were, that is not what I learned, but it's really interesting, right? And it gets to why are we doing what we're doing? If it's to keep people healthy, we got to keep thinking about this. Of course, I'm going to just briefly touch on our neighborhoods. We know that you've probably heard of ZNA, this idea that actually our zip code is a better predictor of our health outcomes than our genetic code, which is pretty wild. You see it in part through life expectancy at birth, and Wisconsin is up there sort of in the higher tier. You see this, you know, across the US, which of course this is not genetic, but something in the environment that's at play. And we see it also on a city level with the historic redlining that then maps on, this is Rochester, New York, where Jen and I went to med school. It maps pretty clearly with the modern social vulnerability index from the CDC and increased risks of disease. All right, so now we're getting into extra fun stuff, which is exactly what we're doing here today. And one of the most overlooked and critical pieces of kindness and social determinants of health is our education. And congratulations to us, because that's what we're doing right here, right now. This is Nola Oakes, who is the oldest graduate I think in the history of colleges. So Nola was, I believe she was 93 when she started her undergraduate degree alongside her granddaughter, or I might have even been her great-granddaughter. And she enjoyed that experience so much, she went on to do her master's program and died after living her lifelong dream of teaching on a cruise ship, which, yeah, it was pretty impressive. And I just want to highlight this because I actually just had this conversation with do we have any med students in the room? Okay, I was curious. Okay. No students for those who are online. You know, in the US, it's remarkable. A statistic is something around like 40% of people can't read above a 7th grade level. And I don't have the exact number, but we had just discussed this with the students, and it's quite striking because we often don't think of education as part of health, but it's clearly a part of health literacy. It really matters when we're giving people directions. And this statistic that was done by Dr. Wolf in Virginia is really fascinating. So what he did is he looked at US vital statistics, and he wondered, you know, how many deaths could be averted if adults with lesser education had been given the same among those with college educated. And what he found was a pretty sizable difference, which works out to an 8-to-1 ratio, which basically says for every one life that medicine saves, education saves 8, which I just like, think of that data for a second. And then think about how we invest we double down on healthcare, and we do not invest in education. And that also might account for some of those big differences that we see across countries as well. But I have to say, this study and talking about this has transformed how I think about health. All right, and then I was so pleased with this slide. So this is like, you know, when you're up late at night working on a slide set, and you're like, I have a great idea. This is gonna kill. So All right, so purpose, and I think we've got time. I'm gonna take a slightly deep dive, pardon the pun, into purpose for a minute, because it's a really cool and interesting area that a lot has evolved in recently, and there's more and more studies coming out that are really fun and interesting and come back to those medical mysteries we were talking about. Like, I don't know if you've ever had even that story of Nola Oaks, like making it to that cruise ship, like, you know, patients that seem to like survive up until like they're trying to get to some event or some milestone. And it is so mysterious because like biologically, how does that work? What's happening? So what's interesting about this is not a new idea that purpose actually impacts health. And Viktor Frankl, which I find really interesting in Man's Search for Meaning, and of course his logotherapy, which he developed after his experiences in a concentration camp, he actually in medical school studied the effect of purpose before all of that happened, which I just find so fascinating. And he has this quote that is, you know, just one of them, that those who have a why can bear with almost any how, which is, of course, paraphrasing Nietzsche, but it really applies when it comes to health. So so studies of purpose typically use scales from Rift scales of psychological well-being, and they ask questions like this, just so you have a sense of it. Or like, you know, some people wander aimlessly through life, but I am not one of them, and other related queries. So here's what is interesting, and I'm gonna run through this in a relatively quick period of time, but I just want you to get a flavor of it so you can dive into it on your own afterwards and ask questions and think about it a little bit more, play with it. So purpose in life is PIL. We love our acronyms. It was hard for me to not put that up there. So high life purpose is associated with a number of different things, like improved quality sleep, lower risks of susceptibility to viruses, improved cognitive functioning, as well as improved mental health. And there are sort of individual studies looking at this. I'm gonna just actually dive into the cognitive health data because it's particularly interesting. And I'm gonna go through two studies, which I've called Study A and Study B. The first study is looking at, this was done looking at 900 people living in Chicago, older people, a prospective study, people without dementia. And they followed them over time with baseline evaluations of purpose in life, and as well as cognitive testing throughout. And then what was really interesting is that what they found over time is that there was high purpose in life was associated with a substantially reduced risk of Alzheimer's disease. And it worked out to about approximately 2.4 times more likely to remain free of a diagnosis of Alzheimer's disease than was the person with the low score. So, which looks a little something like that graphically, which is also just pretty amazing as we're thinking about, particularly with the number of older adults who are getting diagnosed with cognitive impairment, as well as Alzheimer's and other forms of dementia. And then what they did was this really amazing follow-up study where they actually the subjects had very kindly agreed to participate as part of the research in a brain autopsy after death. And what they found is that on the postmortem examinations, that the global burden of disease did not align with what they were seeing in real life and the people's functional impairment. And what was so fascinating about it is that the patients who had higher levels of purpose in life had reduced effects of so even if they had a high number of like plaques and tangles in their brain, looked like the brain of somebody with dementia, they were able to feel and function better in life and perform better on cognitive tests, which is also gets at that idea of like what is that sort of interplay that's happening that people are able to do well even with challenges that they're facing. And I know each of you probably has amazing stories in our trainees too, where you see people with really serious illnesses that are still able to feel and function and participate in their lives. And like, isn't that exactly what we would want for all of us and our loved ones too? All right, which brings us to this amazing field of psychoneuroimmunology, which is a growing area. And also, this was interesting. It was actually started by somebody at Rochester about 40 years ago. I had not realized that. It had kicked it off. All right, so here's just, I want to give this one little piece of the story. So, so we know that high life purpose, when you look at immunology, is associated with lower inflammatory markers like IL-6, cortisol. So lower, the cascade of events happening with cytokines is not happening to the same degree. And it's hypothesized that that's probably what the underlying mechanism is to all of these other benefits that we're seeing to purpose. But then we've got this. There we go. That's the big question. But the question is, does purpose help you live longer? It sounds like it helps you live better, but does it help you live longer? And so that's where there are all these fun studies that are coming out looking at mortality and life purpose. And this was one that was in JAMA that was particularly, it was somewhat recent, right before the pandemic in 2019. But basically what they did in this cohort study of about 7,000 adults showed that life purpose was significantly associated with all-cause mortality. And of course, this is exciting because this is a modifiable risk factor. And I don't know if you get excited about graphs, but this is a really amazing graph. And I'm going to focus in on this little bit here, because wow, like in public health, this is like a clear dose response. Like, so as, you know, as higher, so what we're looking at is low purpose is down here, high purpose is up here, time and survival. It turns out that there was a clear dose response for each increased level on that scale of purpose that showed that increased survival, which is pretty amazing. Oh, and so here's the thing, I just gave away the answer, but so actually the folks at the Blue Zone who look at these things like who's living longer, by their estimate, it gives about 7 extra years of good health span. So good health for an extra 7 years. Even if they're off by like a margin of years, it's a pretty remarkable suggestion that that could make such a difference. All right, and then this is of course an important one, where we all are right now. I'm not going to get into the details of this, but there are really significant, particularly like the Whitehall studies, if you're not familiar with them, that were done in England with civil servants, looking at the effect of health and work. And what's interesting is almost always these studies had their findings by accident, which I don't know, is always so fun when that happens. Like, you know, they just are collecting, they happen to collect somebody's employment grade. And then it turns out there's like a really significant finding, bigger, that overshadows everything else, that in fact, how we're treated at work really matters to our health. And I'm hoping throughout the day, I'll be here, like in our conversations, we can talk more about this, because this is a place for all of you and for all the people you work with where we can make a big difference. I said this quote offhanded, and the World Economic Forum has like run it many, many times. And what it says to me is that people are really ready for more kindness at work in all the different fields that are out there. And it's really interesting to like look at the comments and things that people think about that. So there we have it. We can just end the talk. I think you all understand it's nice to be kind, and we can just go from here. But wait, so of course, unkindness sneaks up all over the place, right? And of course, one of the big ones is fairness. And so as human beings, our brains are hardwired for fairness. We want things to feel equitable. And when they don't, it really gets under our skin. And I know there are a lot of people who do research on this subject and have given talks about this. But we see that particularly when it comes to things like this, like looking at graphs of life expectancy simply based on the description of race. So, and we know now that in the past we had thought that was some sort of genetic difference, but in fact it's, as we all are well aware, it's a social difference. And then of course, you know, there's sort of the blatant things that are done and said that make things inequitable. And then there's these. So, you know, like the moments that you're just going about your day and then all of a sudden out of left field, like something happens. And the thought is, of course, for some of our patients, it also means that it's like death by 1,000 paper cuts, by these sort of tiny microaggressions that distract our cognitive load, decrease our functioning. It's like this interesting cascade of things, which is also something that we can do something about. And then I'm going to take you through the other big piece that is often missing from stories of health, is mental health, right? And it relates to what's happening in our world, and it also relates to what's happening in our bodies. So about half of all people over the course of their lifetime will develop a diagnosis of a mental illness, and with anxiety and depression being by far the most common. Depression is the #1 cause of disability in the world, which is kind of amazing, right? Because we don't always consider that one, but it's there. I say this one, so I'm a consultation liaison psychiatrist, and this statistic always deeply troubles me, and I worked in an ER for a long time. So patients with severe mental illness on average die 28.5 years earlier than expected. And some of that is related to suicides, related to depression, but a lot of it is not. And the thing is, people with, diseases like schizophrenia, sometimes severe forms of bipolar disorder, their symptoms get missed because they are presumed to be part of their psychiatric condition. And so I say this with passion, like, please, please, please always think of your bigger differential, because I found working as a med psych person in the ER that a lot of diagnoses were missed by really good clinicians because they had sort of already diagnostically ruled it out and made an error that later turned out to be not accurate. So 50%, this is the number of physicians who say they're burned out, which is not great, and something we need to be paying attention to. And then this statistic I say with a heavy heart. So this is the number of physicians that commit suicide each year, and it's higher than the average population. And anyhow, I've lost multiple colleagues to suicide, and it's always, always devastating. And it just makes me think, we can do so much better medicine, right? Like, we can do better to take care of our own and help support people. And then, of course, 2020 happened, right? Like the all is lost moment. So, which we're still recovering from. The thought is, how do we go from here? And the idea is post-traumatic growth. So, there's this concept in mental health that it's not just what happens to you. The challenge is inevitable, but the growth is optional. So what can we do to try to grow from here? And really asking this question, and it's the question I pose to you, and I hope that we can have in conversations throughout the day, is how can we create a kinder and healthier healthcare? Because actually, it's not just for our patients' benefit, but it's also for our benefit as well, and for our families' benefit when we're happy too. And we're going to talk about that. And this is a big shift in thinking, in part because of some of the data that's come out around wellness and wellness programs. So wellness is not like a checkbox, right? It's actually a systemic change. And so we have to think about burnout as a problem of the whole healthcare organization rather than individuals. And even the term burnout sort of implies it's like an individual who fizzled out. But in fact, that individual was in the context of a whole healthcare system that could have maybe prevented that. All right, so we're going to get down to work. Just like this is Nola Oakes's quote, set a date to begin, do something, don't just sit there. So let's take some action. We're going to dive in, and I'm going to give you 5 kindness ideas in about 10 minutes. And I hope that something like, come up to me with more. There's so many other ideas that are out there. The first one is just rethinking how we think about health. And so I'm hopeful that all of you are in a place that you're already doing that. And this is just further preaching to the choir. So, I think we've traditionally thought of health sort of down here with this physical health and biomedicine, of course, but now we're understanding that when we sort of look at like, why are some people not thriving despite getting the best medical care? And it's because we're missing those hidden factors in our social world, and we're missing the mental health picture. But I think we're increasingly doing that. Little moment of graphics. And then I actually think, this may be a bold claim, but I actually think that our lack of appreciation in medicine for a long time of the social environment might end up being sort of akin to like the delay in what happened with scurvy treatment, right? So, we know that in 1497, the first reports, basically like case studies came out of lemons helping sailors not develop scurvy. In 1753, this is a picture of Dr. Lind. He did his first clinical trial ever in the history that we know of as part of on a naval ship, and discovered that in fact lemons were helpful. But then there was that curious gap, right? Like, so the Navy, even though they had commissioned the study, didn't implement the finding until actually the year after Dr. Lind died. And then apparently to save money, they stopped giving lemons and switched over to limes, which is where that term limey comes from. And it turns out limes don't have as much vitamin C, so people started getting scurvy. They said it doesn't work. And then it wasn't until vitamin C was synthesized in 1928 that they went back to it, and we finally got the treatment for scurvy. So anyway, I think the thing is, like, our knowledge that the social world impacts our health has been there for a very long time. It doesn't mean we as physicians have to be the ones to fix it, but we have to be aware of it. And I think I was just saying that was like 431 years before. Yeah. So I know we've reduced that, like the average we say is what, like 17 or something, but it's still too long. So okay, so what I think is interesting about this is Hippocrates said this: it's more important to know what sort of person has a disease than to know what sort of disease a person has, which to me says even Hippocrates knew about this way back when, and we weren't necessarily thinking about it. All right, so I want to actually, we can just pause for a second here right now. You can just sit quietly for a second, close your eyes. Yeah, take some deep breaths. I heard some sighs in the audience. All right, wonderful. You can open your eyes again, wiggle toes and fingers. You just made yourself kinder. So it turns out that when we pause, our brain actually, we move from sort of our more primitive brains up to the neocortex, and we're able to actually act in a kinder way. I think I have time for a story that I just absolutely love. So, you know, this has been studied in a variety of different ways, but there's this study yet again from the 70s that's an old one that I don't think would make it through an IRB today, but basically, there was this question of, is kindness, so researchers at Princeton were interested, is kindness an inherent skill? Like, are you a kind person just by virtue of that, or is it somehow contextual? And so to study this, what they did is they recruited a bunch of seminary students, so presumably kind-hearted people, and they gave them the assignment of giving a speech about the Good Samaritan parable. So, you know, about somebody kindly stopping on the side of the street. And then what they did is they said, you know what, we need you to move to where you're giving this presentation. And they told them it's all the way across campus. And to about a third of the group, they said, you've plenty of time, stroll over. A third, they said, you're right on time, just head on over. And to another third, they said, you're running late, you better get there. And then this is the part that is a little sketchy. They had an actor splayed out on the sidewalk who was desperately in need of help, it looked like, and they monitored who stopped. And what they found is that most of the people who had time to get there stopped. About half stopped who were more or less on time, and then only 1 in 10 of the group that was in a rush stopped to go give their speech. So it just says that, like, context does matter, and also that we're less likely to be kind and to do well when we're in a rush. And actually what's interesting is the data sort of shows this, and you know, there's everything from like the surgical pause that's been shown to reduce or improve outcomes, to studies that are showing that pauses help reduce our implicit bias, actually. So one way that you can consider implementing this in your day is, before you pick up the phone, before you walk in to see the patient, just take, like, exactly what we did, like just take a second for 10 seconds and kind of chill out, pause, and you're just more likely to approach the situation with some kindness. Okay, oh, this is another one, because I feel like we reward a lot of things in medicine, but typically a culture of well-being is not one of them. And part of it might be because of some misperceptions around kindness. So there's a thought that, like, well, kindness is being a pushover, but we got a bottom line we got to pay attention to. And so I want to bring up some data from, there's a group at Oxford that's actually the group that does like the World Happiness Reports and things like that. And they do phenomenal data. And they found what's in some ways like the holy grail of the happiness research. So I'm going to just briefly show it to you. And this is not, there might have been some healthcare companies in this data, but it's not healthcare specific, but its story is an important one because it turns out that well-being at work actually really affects the bottom line. And so what they did is they looked at about 1,600 companies. I think it was from the organization Indeed. They looked at all their data and well-being reports from employees. And what they found is that the top 100 happiness companies outperform the others on the S&P, like basically when they're worth more by 20%. So it's actually like, that's like really big news that in fact, it actually also increases and it makes so much sense from a brain perspective, right? Like think about it. When you feel relaxed and not under threat, you are, able to problem solve better. You're more cooperative. You're able to engage and think deeply about things. Whereas like if you're under threat, you are not thinking as well. And so we know that about brains. We've known that for a long time, but that is not always how we treat people in the workplace environment. So just think about what you can do in your environment to maybe change that and to reward people that are doing well. And then, so gratitude, there's a ton of data around this, and it's like everything from like blood pressure to sleep to lower rates of depression and anxiety. That gratitude affects the person saying thank you. So, which I think is really interesting. And then there's studies and it costs nothing, right? Like every organization, every individual can do this. And in fact, I'm just going to give you a little homework assignment to maybe think about somebody who's made a difference in your life and to say thank you. And actually, I'm just going to thank Jen Weiss because she's someone, yeah, actually. She's someone who's made a real difference in my life. And I think a lot of times we think it, but we don't always say it. And I would just encourage you to give it a try. There's this study there's lots of studies, but this is a fun one that from the Journal of Positive Psychology, where looking at nurses who were, they're acute care nurses, and they did a survey on health and well-being. And in the study, which was a little bit of an unexpected finding, they found that being thanked more often at work was positively related to not only the satisfaction of the care that they provided for their patients, but it actually predicted their sleep quality as well as sleep adequacy, headaches, and attempts to eat healthy. So just think about how profound that is. Like just saying thank you to someone in a genuine, authentic way may help that person go home and sleep better at night. It may affect the patient care they provide the following day. It may affect how they interact with their families. It may interact how they interact with their coworkers. So just, it's pretty remarkable. All right, and then this one, of course, purpose, which is why we're all here. So let's just take a moment in our final minutes to think about what inspires you to do what you do. Like if you're a clinician, like what inspired you to go to school and to study? And just take a second. I would love to hear also things that inspired you. Actually, does anybody want to share one or two? I see some like awkward thoughts that maybe, or what inspired you to medicine?
I can share something
Okay.
if no one else will. Do you want me to, should I stand up?
Yeah.
Okay. Okay.
Or come over here so they
All
can
right.
see you on camera.
Okay. So I was just thinking like what inspired me to start the GI genetics clinic that I started here. And because one of my patients yesterday that I saw in clinic actually asked me, she was like, why did you decide to do this? She has Lynch syndrome. And she said, I've been dealing with this for 15 years, knowing this diagnosis and educating myself and educating my providers about it because people don't know, my primary care doctors don't know what this is. And I said to her, I'm like, that's exactly why I started this clinic, because I saw patients who had these hereditary GI cancer syndromes. And I thought, who is taking care of you? Like, why, who is taking care of these patients? Why does nobody know about this? Why do they have no home to go to where someone is at least just watching out for all of the things that they're at risk for, not just their colonoscopies that I get to do? So it was more just finding a home for these people and making sure that they felt like someone was staying on top of the new guidelines and taking care of them. So.
Wow, thank you. Yeah. Well, I would encourage you to just sort of get back to what that thought process was for you. I know for me, it was this idea of wanting to help people live healthier lives, which I know has led me on this journey that I never expected, but has been really meaningful. And anyway, because I think the thing is, just imagine. So let's just take a moment and imagine what a kinder healthcare center would look like, a kinder hospital, a kinder clinic, what that might look like, a kinder world, right? Like a world where every kid has, enough food, clean water, a safe place to sleep, where every adult, no matter what challenges they face, have a way that they feel that they can contribute and that they can have a sense of purpose, where we're able to create and solve problems together and address challenges as using all of that frontal cortex brain power that we possibly could. So I would just encourage you to keep imagining it, keep thinking about it. I have to say, I've given this talk at some not this talk, but versions of it at some at universities and places. And when I say can you imagine this place being the kindest university, in the country, people laugh, right? Like people don't I think that's the thing. We're all aware that there are these pockets, but the studies also show, and this gets at the friend of the friend research that Christakis and Fowler have done, this idea that actually your individual actions, and particularly for our trainees in the room who may not feel they have a lot of institutional power, but your individual actions actually make a difference for so many people around you. So that means you have hundreds of choices during the day to make a choice that might actually lead to a positive change for somebody else. So, and you'll have a lot of fun in the process. I know I've had a lot of fun today, so thank you very much. And I think that's my last slide. Thank you.
All right, we're going to do questions. Jen is going to do audience.
Thank you, everybody.
And I'm going to do online.
Oh, sure.
So I just want to say, this is very beautiful and thank you. Thank you very, very much. So I'm actually going to, the people who speak get to ask first questions. So my first question is about social isolation, post-traumatic growth, the pandemic, and bringing people back together. So, it's been hard to get people to come to grand rounds. I get pushback with wanting people not to come to my division meetings in person. People want to stay home where they can be. People are home right now watching. And so how do we push as leaders to bring people together, because we really need to be in a space together?
I guess I've got this mic on. So this is actually, it's funny, this is a question that a lot of corporations are struggling with, right? And a lot of leaders are getting pushback from people. And I think part of it is being, from what's been successful among those companies and from anecdotes I've heard, is being sort of strategic about the times that you're in person in real life. And then also recognizing, we live in this incredible age of technology. What a gift that there are people, all over Madison and maybe beyond, who are able to be a part of this conversation. And I think what's wonderful about that is it kind of takes all those circles into consideration, right? You're not just a person at work, you also might have a family or an ill family member or something else going on. And that allows for that. And I think that's really great. So it's part of it is learning how to navigate in this and being really intentional about those moments that are important to come together. So I know I've made a point now with team members saying I really need you to be in person for this meeting, and if you can, and it helps. That part's helpful. I think the other thing is like, I don't know if any of you have had this experience where you've seen friends virtually and you can't remember like the last time you saw them in person versus online. Like our brains are starting to blend it all together to some extent. So there is something to be said for having those sort of hybrid experiences. But I would also, for those of you that are listening, like if somebody is like never participating in real life, or I would say just challenge, or you're never turning your camera on if you are in a meeting, like I would challenge yourself to maybe be a little bit more engaged in that way. Because it's funny, I'm an introvert, so like I see the studies about like, oh, it's nice if you talk to your seatmate on the airplane, and I'm like, I don't want to do that, but but it turns out we're happier, and we're happier when there's something about in real life connection that is just so lovely and important. So, and we don't totally understand why that is, but we know we feel it. So
Thank you. Okay, I'll do one online and then pass to you. So online, first question is, if we are
Thank you.
interested in positive psychology in this line of research, what type of jobs and roles do you recommend?
if you're interested in positive psychology and research, I wonder, well, I'm not sure. So it's so funny. So years ago, I suggested to our Department of Psychiatry that we hold a conference on happiness, and I got kind of like a chuckle. So it's funny. We tend to focus very much on like the pathology when it comes to medicine, but in fact, now there's all this data that's being done mostly by people who are in the psychology realm looking at positive psychology, but it blends so nicely with our social determinants of health. So I would encourage you to get involved. Like next week, I'm going to the World Happiness Summit, which is really fun. And like the Surgeon General is going to be there, and all these other researchers, because now people are starting to understand that like it's not just about not feeling depressed, it's also about feeling joyful and feeling optimistic and engaged and a sense of purpose. And I'm hopeful that we're going to start bringing that to our medical centers more. I know there's lots of talks about trying to develop classes around this, and partly it's because we need to take well-being more seriously too. So I would just say like start reading the books, get involved. There's a Masters of Applied Psychology at Penn that's lovely, that that could be something to consider. There are a couple of physicians I know that have gone through the program and really loved it. It's intense, but really good. So, oh, I thought I saw a hand. Okay. I'm also curious if other people have heard of things, like do say, yeah, because there's lots of data and we could implement it.
Well, thank you so much. This was really just
Oh,
awesome.
thank you.
I have a question just for humor. So this doesn't have
Sure.
an answer, but then I have a real question. So my humorous question is, okay, on Reddit, we should have a kindness index for all of our universities, right?
Right.
So that doesn't need an answer, but then the second question really is, I talk to lots of patients about social isolation because I have older patients, want to help them prevent dementia. And some patients say, I'm perfectly happy being by myself. I don't want to engage with others. So it's different than the loneliness. So
Yes. Yep,
what do I
exactly.
tell those patients? I mean, I see the data and the statistics, but they're not lonely. They're isolated and they're okay with
isolated,
that.
right? So it's funny. I just was having this conversation with a friend who's a sociologist who also studies loneliness and social isolation, and he argues, well, there are people who they're perfectly fine. They're just happy being alone, which is true. Being alone is good part of the time. And the data shows that if you can get out and get engaged, it's better. But maybe the other thing is every little bit of social connection seems to help. So you have your deep relationships, right? Like maybe the people that are closest to you, but then actually it turns out that those weak ties, or like the person you see at the grocery store or the neighbor you say hi to, like those actually count too as a positive benefit. So maybe doing something that's sort of starting low and easy and doesn't feel like too much. It can be hard though, because people are pretty entrenched in their patterns. And so just recognizing where they're at and maybe when they come into the office, like there's some way to engage them for a slightly longer period of time or something, or like, this is where some clinics and medical centers are starting to use, because again, it's like physicians already have their plates full. They can't do all this on top of it. And that's why I think people have gotten overwhelmed with it. But if you can start to think about, well, could we offer like some community groups or support groups, or even a book club or something that is of interest to people that might get them a little bit more engaged, or might get them out in the community a little bit more. I didn't touch on it in this talk, but volunteering is like this amazing panacea of like boosting people's health. It seems to follow a bell curve where like if somebody's like volunteering to the detriment of like not participating in other areas of life, it loses its effect. But for people, that might be something to consider. And what's so nice about volunteering, particularly for an older adult, they get to teach back their knowledge, like whatever that is, or or feel like they're contributing or have a new sense of purpose. So anyway, just a thought you might want to consider. Yeah, it's tough, but.
I think we're going to try one more online and then one in the audience. I know we're just at 9, but this one is, I really feel the seminarian parable in our work as a hospitalist. I often feel there isn't enough time to do everything I want to do for the patient and still care for myself, going to the bathroom and eating and drinking. This
Your
leads
hobbies.
me to working at night. Do you feel, as you've worked in the emergency department, which is busier, that it must be harder for providers there to be kind? What kind of advice do you have for those of us who feel this way?
Careers have seasons too, right? So there'll be periods that are busier than other periods. But I think this is a tough question. So knowing this knowledge, it can feel a little overwhelming, like there's too much to do, too much to accomplish. But I would say also be kind to yourself and look for the helpers, right? So like other people can help you do this, and they don't have to have a white coat. Like, you can put together, or maybe I just had another idea, like, a model that's been used a lot in mental health is peer groups. So we're forming a peer group and we want you to help lead it. Would you be willing? Utilize people. That's less of the hospitalist question, more your question, but I would say utilize who's around you. But the funny thing is it takes like a moment to check in with somebody, even when you're on the ward, just asking the nurse, how's your day going? Or, asking a colleague, how are they holding up after whatever's going on? And those little things make a difference. And then when it comes to self-kindness, particularly when you are really, really busy, sometimes that's actually also showing up and being present and connecting with other people. And the evidence shows that even these little acts of kindness make you feel better. So if you're in a slump and you're in some sort of a funk while you're on it, just consider doing something random, even giving someone a cup of coffee, or something small, or a smile. Even passing people in the hallway has been shown to increase trust and sense of community when you look at them and smile and say hello, and your neighbors too. So anyway, those are just some of the ideas, but hang in there. And also let's support one another, because if we feel our colleagues don't have time to use the bathroom, that's a systems problem. So yeah, all right. Okay, all right, thank you. Thank you so much, yeah.